The following programme, produced and funded by MyFaceMyBody, was also partly funded by Zoom, TSL and iGuide.
Welcome to My Face, My Body, the show that aims to answer all your health and beauty questions. In this series, we'll be travelling the length and breadth of the UK to bring you the very latest cosmetic and beauty treatments on offer, answering all the questions your body needs to hear. So, what does a horse have in common with the actress Jennifer Aniston? Coming up on this show, we give you ideas of how to get your body into shape and some effective weight loss and body shaping procedures. We look at some popular lunchtime treatments and we travel to Hertfordshire to bring you the latest consumer research. Hi everyone, we're in the beautiful location of Edinburgh to bring you the latest celebrity gossip. Does this look like a man who's had cosmetic surgery? No, we didn't think so either. He could certainly do with a bit of Botox. However, it seems Sir Alan Sugar, the businessman and TV star, was so upset by his droopy eyelids that he decided to have a blepharoplasty, otherwise known as eyelid surgery. He wanted the operation to remove baggy skin around his eyes to improve the appearance of wrinkles, bags, and droopy lids that make the face appear old and tired. Well, the skin around the eye area is very thin and is one of the first areas on the face to show the signs of aging. So perking up the peepers with this cosmetic surgery procedure can refresh the appearance of the face and leave you looking years younger. We guess the boss of the BBC's Apprentice just couldn't face people telling him, "You're tired." Well, fans of Coronation Street often wonder why the characters have these great tans when Manchester, where the program is set, is invariably raining. It's no real surprise that the healthy glow is out of a bottle. Street heartthrob Chris Fontaine, who plays Weatherfield womanizer Tommy Duckworth, has been teased non-stop over his orange-tinged skin. It serves to remind us that when used correctly, fake tan can give you a healthy glow and leave you with that just back from holiday buzz. But when too much is used, that tango look isn't flattering. In fact, 58% of men told us they thought the orange fake tan look was too false and looked terrible. Remember folks, less is more. Now it's almost 4 months since Pippa Middleton's bum almost stole the show at the royal wedding of Kate and William. Yet it seems like the famous derriere is still making headlines. Now it has emerged that the young Middleton's bottom is America's most wanted, as Pippa's posterior tops a list as the one most women want. Her curvy yet slim rear is now the most requested bottom by women seeking a designer derriere at plastic surgery clinics. So what's next for Pippa? Well, we'll have to wait and see. But that's all your news this month.
Boxing or boxercise is a great way to lose weight, de-stress and have some fun. The thing with boxercise is that you don't even realize that you're working out. It's that much fun. Right, as I'm going to demonstrate with Steve, we're going to go through just some really simple routines that's going to work his whole body. All right, Steve, don't break my hands. Let's go. Good stuff. 1, 2, 3, 4. 1, 2. Good stuff. 1, 2, 3, 4, 5, 6. Good stuff. Add a duck at the end. 1, 2, 3, 4, 5, 6. Good stuff. 2 knees at the end. 1, 2, 3, 4, 5, 6. Duck. Knee, knee. And again, one more. 1, 2. Nice and hard. Duck. Good stuff. So as you can see, Steve's just had a really quick full body workout. Used all these aerobic systems. How do you feel? You feel all right?
Pretty good.
Okay, good. Men and women can do this. Most PTs do it. I use it with most of my clients. I use it with Steve on a regular basis. All gyms have a box size class, so check it out.
In our clinic, we offer a very specific treatment called Allison Weight Loss and Body Contouring Treatment. It basically consists of 3 elements. One is a very specific diet, which is an Allison diet. It's not your typical weight loss diet, which is just protein milkshakes. You can actually have real food like salads and vegetables, and there are specific foods that you mix with that from the Allison point of view. You never ever feel hungry on the diet, which is the main thing, so you don't have to starve yourself all day. And that diet is then combined with 2 treatments in the clinic, which you have once a week. One of them is called an ultrasound treatment, which is a lipo-ultrasound that dissolves the subcutaneous fat, and the other one is a connective tissue therapy with an LPG machine. And that basically helps to drain the lymphatic system, so the fat goes back into the circulation. It also helps with body tightening and cellulite treatment. So as you lose the weight, your body gets contoured as well, and you don't end up with too much saggy skin.
The truth is that everybody goes on about weight, and it's not really about weight. It's about shape. One of the undoubtedly irritating facts of life is that every time you gain a pound, you gain it on all the places you don't want to gain it on. Every time you lose a pound, you lose it off all the places you don't want to lose it off. So you gradually attain this shape that you don't like. The common scenario is a lady will come to you and they'll basically say, take it all away. And the problem with that is that the female form is supposed to have fat in certain parts. Obviously, maybe not as much as they've got, but certainly it's supposed to have some fat there. And often if you take it all away, you're left with a more straight up and down figure, which in all candor looks more masculine. And therefore sometimes it's important to adjust the patient's desires, if you like, to an area and a shape that's going to make them look better. All forms of liposuction are about shape. VASER is able to improve shape quite significantly. It can't remove all of the fat from a particular area, but you certainly get good, photographically identifiable shape change, waist size change, clothes size change. You get it with a process that takes about an hour and a half. And it does involve some degree of invasion of the body with probes and things. We minimise the trauma to the internal tissues, so that's why we get such a rapid recovery.
Do you enjoy a good curry? Well, I know I do. I'm here in the heart of Brick Lane, world famous for its great curries. But it's all important about getting the right balance in our diets. And we're here with Kim, our nutritionist, who's going to give us her top tips.
A meal out is a great way to spend time with friends and family, celebrate a special occasion, or treat a loved one. But what and where should you eat if you don't want to destroy your diet in the process? Here are some top tips for enjoying a healthy meal out. Manage your hunger levels. Having a healthy snack before getting to the restaurant will ensure you're not ravenous when you arrive, making you want to devour everything on the menu. Avoid the bread basket. Bread is high in refined carbohydrates which promote weight gain. Opt for olives instead. Alcohol. If you're planning to drink with your meal, don't drink on an empty stomach. Having some food first will slow the absorption of alcohol into your bloodstream and limit the negative effect alcohol has on your health. Ordering. When ordering, remember you can ask for something different to what's on the menu. For example, ask for chips to be replaced with some seasonal vegetables or a fresh salad. Cream-based sauces can be switched for healthier tomato options. Avoid carbohydrate-based meals. Dishes like pasta, rice and noodles will promote weight gain. Go for meals based on proteins such as seafood, fish, or vegetarian proteins such as beans and lentils, commonly found at Indian restaurants, or tofu, often available at Oriental restaurants. Eat slowly. Enjoy your meal and recognise when you're full. Eating out doesn't have to mean overeating. Where to eat. Choose restaurants whose nationalities have the healthiest populations. For example, Oriental restaurants such as Japanese, Thai or Vietnamese provide much healthier choices than an American burger bar. Desserts. If you fancy something sweet at the end of your meal, why not share a dessert instead of having one all to yourself? Or you could be truly virtuous and ask for a bowl of fruit such as raspberries and strawberries. Following these simple guidelines will make sure that you can enjoy a meal out without compromising your health or diet.
This programme, produced and funded by MyFaceMyBody, was also partly funded by Zoom, TSL and iGuide.
I'm Jeff Wilson from Surrey Plastic Surgery Services, and I now offer the iGuide neck lift.
It's the simple way to have a younger looking, beautifully contoured neckline. The iGuide surgical suture system offers an unprecedented, minimally invasive technology that in many cases can be performed without general anaesthesia and with minimal incisions, resulting in great benefits for both patients and doctors.
The iGuide is a very simple procedure, like all the best procedures, which passes a permanent thread back and forward on the neck and then tightens like a corset. The scars are absolutely minimal and it gives a good long-term effect on the neck. The ideal combination are for ladies who are developing early jowls, and we can do a mini facelift procedure to tighten up the jawline and an iGuide to tighten up the neck.
Now you can enjoy natural looking results with minimal recovery time, which means you'll be back to work and back in the gym in days compared to weeks or months with traditional invasive procedures.
I'm really excited about iGuide because I've been waiting for many years for something good to do on the neck, and I think this is it.
You're on holiday in Stratford-upon-Avon. You've been to the theatre, you've seen Shakespeare's birthplace, you've even had an ice cream. But what do you do for lunch? Well, you come to this place. Well, we're here in the beautiful Stratford-upon-Avon, and we're really interested to find out a little bit more information about lunchtime procedures. This is a popular place for people to come and see you to have treatments during their lunch break, would that be right?
Yeah, absolutely. I mean, we're a small town. People can pop in and get a treatment done and go straight back to the office. What they're keen to do clearly is go back without any visible evidence of having had anything done. We have treatments which would involve using a machine like radiofrequency skin tightening. We have Pellevé in the office, which is non-invasive, no anaesthesia. It uses a small handpiece which goes over the skin like a little magic wand, really. It causes immediate skin tightening, but afterwards nobody knows you've had anything done.
Now I know what they do in their lunch breaks in Stratford-upon-Avon, I wonder what they do in Middlesex.
The most obvious and probably the most common cosmetic dental procedure we do is teeth whitening. It's really popular, we've got systems that really work and we can always deliver really great results, short time, and in a lot of cases the treatment's really done at home. So there's not a lot of time someone has to take out of their day to have their teeth whitened. Something just a little bit more than that is composite veneers or composite bonding to teeth. Composite's really great and has come a long way in the last couple of years. We've got materials which we can just place on the tooth and can be polished up to look exactly like teeth. We can change the shape of teeth, we can close gaps, we can do a lot with just composite. And time-wise, it might take 1 or 2 hours, max. Relatively short procedure, but you can walk in and walk out with practically a new set of veneers.
Well, it seems like people in Middlesex also like to have treatments in their lunch breaks. But what about London? Did you know that the top 3 procedures in London are dermal fillers, Botox and microdermabrasion? But do Londoners have the time? So what's on the menu for lunch today?
Well, Steve, there's anti-wrinkle treatments, there's anti-sweating treatments, and there's dermal fillers for volumizing.
And I thought I was coming for a sandwich.
Lunchtime procedure for the facial aesthetics would be having your botulinum toxin, perhaps having some dermal fillers, just depending on the amount one would have and where you'd place the fillers. Most of the people who come along initially for lunchtime would want anti-wrinkle treatments, and that's usually from the upper face point of view. When we do inject, we make sure that everything is prepared. Preparation is vital. It takes me longer to prepare the client than it does to actually do the treatment. The treatment for the botulinum toxin in the upper face probably takes about 2 to 3 minutes, if that, from beginning to end. But it's the actual preparation, getting everything ready.
So why do patients say, your patients say that, you know, why the treatments are so comfortable and painless? What do you do in terms of the injections or the preparation that makes it painless for them?
Let me show you.
Brilliant.
Let me mark you up,
okay,
as we would.
Excellent.
All right, Steve, so now I'm going to show you my markers and the ruler and just run through how we mark up. Here's my marker pens. So the first area, this is the glabella, what we call the glabella region here. This is be angry. This is where people are angry. Oh, my goodness. I can see, oh, my goodness, you must be angry a lot of the time. So we're going to...
I'm a scary guy.
You're a scary guy. Look at that. Wow. So that's excellent. There's usually 3 areas that we mark up for the upper face. There's this area here, which is our frown area. There's the forehead area up here from the lines on the forehead, and there's something we call our smile lines, our crow's feet. Now, the other thing we do, we measure. So we mark and measure, and the reason that we mark and measure is that we are extremely precise. So when I come to inject you, I know exactly where I'm going to inject, and literally I don't have to think about where I'm going to inject and how much I'm going to inject you with.
Great. Well, I think you've got it there. I think we've had a great variety of lunchtime procedures. So if you do have an hour break, come and see one of the experts to have a consultation and see if one of the treatments are right for you. If you're a new mum, you probably don't have time to even think about getting back into shape. We can't all have it like Victoria Beckham, that has her own chef creating her a no-carb, no-sugar diet. So what do women want? Do they want a helping hand from cosmetic surgery to get back into shape?
There are many changes that happen to a woman's body during pregnancy, and these changes obviously affect the body after pregnancy, and it is a big concern for many women. You've got changes in your hormones, there's fat deposition, there are nutrients which we are normally used to absorbing into our body which affect our skin, which are then taken by the baby, and all these changes do have an effect on a woman's body.
Being pregnant, I think my body's going to go through a lot of changes. Maybe might get a few eye bags off, like sleepless nights and things like that, but things like stretch marks and things like that are going to be a worry.
Having children is obviously a momentous occasion in any woman's life, but it does take its toll on your body. And certainly when I had my children, which was about 12 years ago, there weren't quite so many procedures or lotions or whatever available. It was very much sort of a little bit of oil and, you know, fingers crossed.
There are many things women are concerned about after having a baby, but 4 of the main things that we tend to see in the clinic are acne. There's been changes in the skin due to the changes in hormones in the body, and quite often this can lead to the increase in oil production within the skin. And for somebody that may have had a previously beautifully clear skin, suddenly they're developing problems with spots. One of the other problems that we do tend to see in the clinic are pigmentation changes. This is a very common problem post-pregnancy and can mainly affect around the mouth area or around the eye area across the cheek. Now, these conditions are called melasma or chloasma, and again, they are caused by the changes of the hormones in the body during the time of pregnancy. But one thing that may not help is sun exposure on top. Last but not least, one of the biggest, I think, for many women post-pregnancy are stretch marks. Unfortunately, as the body expands, the elastin in the skin becomes stretched. Following the birth of the baby, the skin then may have difficulty in retracting, and hence the development of stretch marks.
Developed stretch marks quite late on during my pregnancy, and wanted to be able to wear a bikini and that kind of thing. So came along, had a consultation with Jo to see if she could sort them out. And I'd also had a C-section when Alfie was born, so she said that she'd be able to laser that for me as well. And it's definitely taken away a lot of the redness in the scar in particular. It was very raised and now it's become quite flat. And my stretch marks have pretty much gone, so I'm delighted.
Treatment like stretch marks, cellulite, yeah, I'd definitely consider it like once I've had a baby, because you get back into the gym and things. and those aren't going to go away from the gym. So yeah, cosmetic surgery's the only way, really.
Women are perhaps worried about having any sort of toxins or any products put into their body, maybe not long after they've had a baby.
With most treatments, you can usually have them after you've stopped breastfeeding. However, with some treatments, it's advisable, purely from an aesthetic point of view, to allow the body to recover for possibly 6 to 12 months.
When I came for my consultation, Alfie came along with me, so he got to see all the weird things that Mummy was going to have done to her. And yeah, they're really friendly, they're really welcoming, and I would definitely come back again to get something else done. I need to find something else that's wrong to get fixed so I can come back.
For acne, I would recommend laser, chemical peels, or the derma roller. Prices for those treatments vary from £300 to £500. The second treatment we discussed was pigmentation. Again, this would be using either the laser or the chemical peels. Prices for these treatments generally start around about £100 per treatment. And last but not least, we discussed stretch marks. The treatment I would recommend for stretch marks would be the derma roller. And treatments generally start around about £300.
When you think of cosmetic surgery centres of excellence, you probably think of Harley Street, or maybe places such as California or Rio. You won't often hear Hertfordshire mentioned, that's for sure. Yet we've found a clinic of cosmetic medical excellence in Riverbanks Clinic, offering treatments such as vasolipo, injectables and skin treatments. Well, I thought I'd treat myself to a visit and see how some new equipment at Riverbanks is having some remarkable results on skin rejuvenation.
Years and years of sun damage, I wanted to minimise that. Also, I did suffer with spots as a teenager, and really I wanted to get rid of the scarring.
I was getting married and I basically wanted to look as good as I could on my wedding day. I didn't want to look different or younger, I just wanted to look as good as I could do for my age.
Anti-aging aesthetic treatments have become extremely popular because they've become more affordable, but more importantly than that, they actually work. Botulinum toxin treatments are extremely versatile. The most popular use is to help reduce the appearance of excessive frowns and wrinkles, typically between the eyebrows or on the forehead or around the eyes. People call those crow's feet. In the past, people were over-treated, given the appearance of a frozen look, and it's not something we do here at Riverbanks at all. All of our patients leave looking very natural.
The treatment I had was the derma roller. Dr. Jane, he rolled this instrument over my face. It had quite a few needles in, very, very, very fine needles. Didn't really hurt at all. After the second month, people were starting to notice a real difference. By the third month, people were actually saying, "Oh my goodness, what have you had done? Why do you look, have you been on holiday? What's different?"
As we age, our face changes shape. It loses volume in some areas and gains in others. Dermal fillers are used at Riverbanks Clinic to replace the lost volume which ages the face. Typical areas are below the eyes, on the cheekbones, the cheeks, between the nose and mouth, and around the chin area, and even the temples. It's not just about the nose to mouth lines, which is where most people hear about using dermal fillers.
A lot of people on my wedding day said that I look very glowing, very radiant, and that comes across in the photographs, and that I think is because of the treatments that I received at Riverbanks.
The typical Hertford girl is fake tans, hair extensions, eyelashes.
Typical Hertfordshire girl would be high maintenance. She loves coming in and spending money on herself, making herself look good.
When I go out in the evenings, I'd like to wear false eyelashes, a lot more makeup, a few hair extensions, and a bit more fake tan as well.
The appearance is quite a big thing in Hertford, yeah.
This guy is a brave guy, I'll tell you.
Your shaped brows look a bit better, so you haven't got the bit in the middle, joining it up. Gonna have a nice hot shave.
Yep.
very refreshing, makes you feel brand new after.
So you're a plumber, yeah?
Yeah.
And you got your own plumbing business?
I indeed, yes.
Fantastic. And you hire a few guys and...
Yeah, got a few guys working for me, yeah.
Oh, great. For their incentive, they can come in here. And have you tried it already?
Yeah, definitely, yeah.
Okay.
Yeah. He's my friend down from Peterborough up north behind me. He comes down and that, yeah, so he introduced a few people and whatever.
Yeah. You don't feel it at all, do you?
No.
Oh, there you go.
Yeah, you've got to do the other ear now, otherwise they're going to be here. You've told me about something quite different, is laser dentistry.
There are a variety of lasers available, and we have a variety of lasers that do different things. So it's not just having one laser machine to do the odd treatment. So we have 3 or 4 different types of laser machines available. And with that, you can either whiten teeth, you can reshape the gums, so you can actually improve the gums, enhance them, so the smile looks better without doing any other dentistry. We can do drill-free, pain-free, needle-free dentistry on our patients, especially young children, so we actually get them to experience comfortable dentistry.
I mean, that is the one big thing I think that scares a lot of people off going to the dentist, isn't it? Is the pain,
absolutely,
the drilling noise. But this sounds like it's a good solution to people that are scared of the dentist.
And how many times do you have people say to you they've had wisdom teeth problems?
Yes.
And often they say they need to have the wisdom teeth removed.
Yep.
Well, there are certain treatments available with a laser where you can actually make them so much more comfortable, and then you don't often have to take those teeth out.
Great. I mean, do many practices around the country offer laser technology treatments, or is it something quite particular to your clinic?
The actual laser machine itself does vary, and they are quite expensive machines. So it depends on how many practices actually go and invest in all the variety of lasers available.
Yeah.
So lasers have been around for a while, but most practices have either one or the other, but not the entire group of lasers that are available.
So what does a horse have in common with the Hollywood actress Jennifer Aniston? Well, you might have guessed it, horse shampoo. Apparently, according to the media, she uses a similar shampoo that horses use to keep their hair shiny, silky and healthy. But also, horse riding itself is a great recreational sport, something that you can think about rather than going to the gym. Now, I'm with Jennifer at Mount Maskell Stables, and she's going to tell us a little bit about the benefits of horse riding.
Thanks, Steve. Yeah, we're very good here today. Very difficult to pinpoint the benefits of horse riding because I truly believe that they are the whole person. Horse riding is good for the body and good for the mind, good for the soul. In terms of physical activity, riding uses all your muscles, particularly core strength, legs. It requires coordination at the highest level, very, very difficult. It looks as if a good rider's doing nothing, but in fact...
You definitely feel it after even a short ride, especially the next day, isn't it?
Definitely, definitely. And it's an outdoor activity.
So yeah, it's not just in the stables, you can go out and do walks.
We obviously start people, we have a look at them in a safe enclosed area, but you know, out riding is something that a lot of people really, really enjoy, gets them out and about, enjoying the countryside and really benefiting from that experience as part of their horse riding activities.
Well, there you go. I think Jennifer summed it up. Have a go. Now, if you want to find out any more information about horse riding, go to MyFaceMyBody. If there's any questions you have on some of the topics, go to MyFaceMyBody.com and don't forget to follow us on Twitter and Facebook. I'm going to get back to my horse riding, so we'll see you next time.
This programme was produced and funded by MyFaceMyBody. It was also partly funded by Zoom, TSL and iGuide.